and end-of-life care in working for the ICB. This is a joint venture which is happening between the ICB and Reading Borough Council, and it's a real pleasure to invite you to explore what it means to create a compassionate community to support dying well for the people of the Reading area. And this is a project that is happening over the course of a year. We're hoping that it will lead to many other initiatives that then follow on beyond that year, well beyond that year period. And we set ourselves particular aims for this. One was to improve the experience of people and their carers who are living both with life-limiting illness but have need of end-of-life care. And what we know from other parts of the country is that one of the most powerful ways to do that is to drive a public health compassionate community initiative. Compassionate communities have happened elsewhere in the country. They're very much about bringing together all the people who work with the public to both inform and enable better experiences for people who are facing the end of their lives. So this is something that we've set about with a series of different initiatives. And this webinar is one of a series of webinars. It's the second one, where we're looking at specific topics which help us to really drill down in terms of what is needed for that area of work. We want to collect together a network of compassionate community champions. We're already doing that, and all of you on the call are already helping us to create that network of champions. We're using it alongside the work that's happening with Respect, which is being rolled out across our ICP footprint. And we're running a series of focus groups, which many of you are helping us with, to listen to the voice of those with lived experience. What we know and why this is particularly relevant today is that carers have specific need for both support and resources. And in order to do that, we need to have these sorts of webinars to collate that guidance as to what is needed and what should happen. And we are planning a series of public events, and in particular, we'll look at that during Dying Matters Week. Our ultimate goal is to have a civic charter for Reading, which will be about that compassionate community and about dying well. And that will feed into the Dying Well strategy that's being written as we speak by the ICB. So if I move to the next slide, it's just to give you a little bit of housekeeping for today. The meeting is being recorded, that's so that it can be shared with others outside this meeting. I'm working with a number of people from the ICB and from Reading Borough Council. On the screen you can see Bev, who's with me today and helping to manage the slides. Thank you, Bev. There are some other people behind the scenes, their names are listed. And we have a number of speakers today. Can we ask just that people mute if that's possible? Thank you. So the speakers today include Millie, Paul and Alison and Tracy. I'm going to let them do their formal introductions, but they each bring a particular aspect of why this is relevant and what we can learn from each other. We would ask that you would mute as if you're not speaking, but we are going to, as I say, record. And we want your email addresses in the chat, because what we found is when we circulate this meeting out, we don't always at the end of it have your email contacts to follow up with further information. There's one specific thing we're going to do, which we've captured on the next slide, which is around running a poll. And the poll has got will happen throughout this hour that we've got together. We're asking many of these questions in all our webinars to really collect views from people. And the questions are these listed. What does dying well mean to you? What enables us to give good care to achieve that dying well? And specific for this webinar, what would be useful to include if we were to have an information pack to try and help guide both patients, carers, and those that are involved in a loved one's deterioration and approaching death. To avoid any confusion, I just want to just talk you through. You'll see at the top bar that there is actually along where you put your camera and your microphone, there's a little button saying polls. You can click on that and then it brings up the poll in place of the meeting chat, and it allows you to contribute to your thoughts, and it creates a word cloud, which is very useful for us for assimilating your views and the power of those views, how many people agree with you. If you want to close that box down, you will go back to see the speakers and the speakers' slides. If you've got any questions, pop them in the chat and we'll try and answer them to help make that work smoothly. But I think it's probably with no further ado, I should pass on to them to give Millie the chance to set the scene for what she wants to share with us today. So Millie, may I ask you to kindly introduce yourself and just share your work with us today?
Yes, no problem at all. Hello everyone, thank you so much for having us this afternoon. My name is Millie Taff and I'm the Carers Lead at Reading Borough Council, and I'm joined today by Tamara, who's a Reading resident who has really kindly agreed to join me today to share her experience of being a carer for her husband, who was diagnosed with dementia in 2021 and who sadly passed away in October 2024. So first I'll share some of my own experience as well as outline a bit about my role, and then we'll hear from Tamara about her lived experience and what's helped her as a carer for her husband through his final years. So as you know, the theme of this webinar is supporting carers, and it's an area that I'm extremely passionate about, both from a professional and a personal point of view. And my job is to lead on the delivery of the carers strategy and action plan. And this is the plan that aims to improve support for carers in Reading of all ages, caring for people with all conditions at any stage of their life. And it includes young carers, parent carers, adult and working carers. Could we just have the next slide, please? Lovely. So I came into this job following my experience of becoming a carer for my mum when I was 17 years old. She had a severe stroke which left her unable to speak, unable to swallow. She was paralysed down one side, she was very unresponsive in the first few months and stayed in hospital for 6 months prior to her coming home and me becoming her carer. So whilst we were lucky that she did begin to make progress and start to recover, in those early weeks and months, we weren't sure how things would turn out. She was unable to communicate at all. So as a family, we had to have discussions around what mum would really want in this situation, whether she would want full medical intervention to prolong her life when her quality of life was very unlikely going to be the same ever again. So these are very challenging conversations to have during an acute illness when emotions are already heightened, especially as my brothers and I were under 18 at the time. Less than 1 year after mum was discharged home, my dad was then diagnosed with cancer. So we were again in the position where we had to think about death and dying. These are things that nobody likes to talk about, but we had to have these conversations about both of my parents in a short space of time. Since then, as a family, we've become extremely open about talking about death. I now know exactly what level of intervention my parents would want, where they'd like to be cared for, details about their funeral. We've made it as normal as possible to speak about. So I think it's incredibly important to know exactly what your loved one's wishes are in case a time comes when they're unable to express their wishes. So my main take-home message is don't wait until it's too late to have these conversations. As I saw with my mum, our ability to speak and communicate can be taken within a split second. Both of my parents were under 50 years old at the time of their illness, so this is not just for the elderly. Life is unpredictable, so I strongly feel all families should have these conversations as early as possible, even before life-limiting diagnosis. The next webinar will cover practical options for recalling these wishes, such as advanced care planning, respect forms, wills and LPAs. So they're all really important to get in place too. So come back for the next one. So within the work I'm doing in my professional role is to deliver the carer strategy. And we've identified that carers for loved ones nearing the end of life as a priority group. This is because they have unique support needs compared to other carers, mainly due to time limits and conditions. So feedback from carers suggests that finding information about what support is available, such as support groups, can be really overwhelming at an already incredibly difficult time. The information often is available, but it might be found across numerous different websites and different organisations. So we're working on developing a kind of one-stop shop carers support guide for those nearing end of life, or for carers supporting those nearing end of life. If anyone wants to input on this project, please send me an email because it's something that I think we need to get right and get the right information to the right people at the right time. And it's through these support groups that I met Tamara. Tamara continues to attend the AGK Reading Dementia Carers Support Group, and she really helps others who are currently going through the diagnosis and supporting somebody. She's also a volunteer befriender for AGK, and I think you find that extremely rewarding as well. So when I spoke to Tamara about this project, I could see the comfort that having had a good experience in the final months for her husband brought her. So whilst the death of a loved one is never easy, knowing a husband was in a safe and caring residential home that communicated really well and offered her support was extremely comforting. So let's find out a bit more about Tamara's experience. Would you mind sharing a bit about the early days of recognising the signs of dementia and how you went about seeking a diagnosis?
Yeah, hi everyone. My name is Tamara and I live in Reading, and I was married to my Spanish husband, Joaquin, for 28 years, and I was his unpaid carer. So in early 2020s, when we have COVID periods of our lives here, I noticed some changes in his behavior and memory. One day, he was early in the morning, he was not at home, and I went outside looking for him. I saw a police car, and I talked to a young policeman, Sammy was his name, and I told that my husband is missing from home. He asked a lot of questions, and he was going to report his missing. And then we saw my husband walking across Oxford Road to our house. So after a short conversation with him, policeman turned to me and said that he thinks that we need to see the doctor. We went to see the doctor, Potteries at that time, and the doctor referred us to memory clinic because both policeman, I guess, and doctor recognize that this is the symptoms of dementia. I never came across dementia in my previous life. In my family, we did not have. So I was unaware.
Sorry.
Yeah, and soon after GP referral, we had a home visit from a consultant psychiatrist for older adults from Memory Clinic, Hazelwood Ward, Prospect Park Hospital. She came to our house, and she was in our house for about 2 hours, just simply talking and asking questions, and she did some psychological test. And then I received a letter, which I have with me right now. Yeah, I think I will skip this like that. On 5 pages, she wrote the history of the patient, and it was history of presenting complaint, past medical history, current medication, family personal history, talking about his parents and grandparents and brothers, sisters, social activities of daily life, mental state. So this was a wonderful document. I was reading it like a novel, and I thought, if this doctor had not been a psychiatrist, he should have become a writer. But the most important for me was at the end of this story of life of my husband and me and our family, at the end of this, and after diagnosis was actually mixed dementia, Alzheimer, and vascular, and atypical one. Yeah, at the end of this, it was a care plan, 12 points of a care plan. Investigation, CT scan, something for GP to do, something to do for social services, to have needs assessment, attendance allowance for me as advice that I need. I did not have, I did not know what is that. Dementia advisors, yes, I will refer why for this. Understanding dementia cause, and also important was further on this list, carers support for relatives and non-professional carers. Again, all contacts, memory clinic, social services referral. To Vida, it does not work, they don't work anymore, but it's West Berkshire Carers Hub now. Dementia Care Advisory Sites, it was so helpful for me. It was like the light in the tunnel for me.
Thank you so much for sharing. So it sounds like having access to that information at the right time made a really big difference to you as a carer. So when you had all that information, what support services helped you throughout his diagnosis?
Right, I would like to say that first of all, NHS. Obviously, I understand this is their job, but what is important, NHS, I mean Prospect Park Hospital, obviously, Memory Clinic, Hazelwood Ward, Royal Berkshire Hospital. He was admitted several times because he had laser operation on his cancer. Then South Central Ambulance. About these people, I just want to tell in my own words. When they first came to our house, I thought they came from another planet. They were so fully equipped with this all equipment. They were looking like in some film from 22nd century. And all their test, all the equipment, everything that have it doing to the patient in our house, this was unbelievable. So I used South Central Ambulance. We had them about 4 times. Also, except NHS, obviously, and hospitals, I had this understanding dementia course for carers over 6 weeks. A clinical support practitioner from Memory Clinic. She started to visit us on a regular basis, and she brought a whole collections of books and booklets about dementia. I have read all of them thoroughly. I'm a very experienced person now. So this was everything very helpful for me, including police who came several times to our house when he was missing, looking even in my shed, but they found him everywhere and in other places in Reading. So Thames Valley Police was excellent. On one occasion, I want to tell, when they start looking for him, I went outside of my house, and across the road, I saw 3 police cars. And policeman was standing near our fence. And I asked, what these 3 police cars doing over there? Is there any accident? And he told me, no, we are looking for your husband. We are taking this seriously.
Oh, bless.
Yeah, so it sounds like all of that information and support you got was very validating for you as a carer.
Yeah.
Would you mind now sharing your experience of what came next in terms of as things progressed and you started to look for care and preparing for the end of your husband's life?
Yeah, obviously his health was deteriorating and his needs increased. And at some point I needed some short respite, which care assessment from Reading Borough Council Social Services included in his care plan. So I was looking for care homes, and I was using primarily homecare.com website to look for care homes in Reading area for short stay. And about a dozen of them I research information. I visited them. The problem with short stay is almost all of them did not have availability, and another have a long waiting list. After waiting for 1 year on a waiting list, we had a short stay in, it's based in Caversham, in care home, because I needed to repaint his bedroom and change glass in double glazed windows. I did not have any rest because even I was advised not to go and have a rest for 1 week. I just could not. So I visited him every day. And unfortunately, in 2024, he collapsed at home, and ambulance took him to the Royal Berkshire Hospital, where he stayed for several weeks. Council, social services, and me, we were looking for a care home because at home there was no chance for his safety. Bedroom is upstairs, bathroom he need to step and he could not, and these 13 steps to the first floor, no way he could walk anymore. He was very poorly. So he was in one very good nursing home, but it appeared they have all they are all patient residents are in wheelchairs, and my husband was weak but mobile, and he wanted to walk along long corridor. So council was looking for about 5 or 6 another care homes for permanent state, and all of them refused on the basis that my husband had a challenging behavior. I visited a care home near me, 15 minutes walk. excellent care home, and together with the council, he was accepted in this care home. And what a care home it was! It was like a family for him for his last 5 months of his life. And a little bit about this care. Everything is completely computerized, from patient records to medication. They have smiley, friendly staff. They have choices of menu. I have eaten twice in there. So you can choose on menu some dishes, no bones, everything nice. Long corridors for walking. Residents can walk, can run, whatever they like, entertainment, different activities. And I asked them, when can I visit him? And they told, anytime. You don't need to book appointment to visit. You can come anytime. So I was there every day. Sometimes I was twice a day. But when 5 days before his death, he was a very strong man, actually. 5 days before his death, he stopped eating and then drinking and then swallowing, and he was laying in bed. He was, I think, half conscious because he could not speak anymore. Only I asked him to say if he is okay, he would press my hand. And I asked him if he is no pain, he press again, no pain. I experienced people dying twice. I was present at my mom's death. I was looking after my mom for 3 months, and I was with her to the last minute of her life. And I was with my brother for 12 days before he died, in the last minutes of his life. And I research a lot of information on the internet, and I know what I need to say. First, obviously, they need comfort. This is what the doctors who contacted me, they asked me, do you agree that we prepare him for the end of life? And I said, yes. And what would you like? Do you want him comfortable? Yes, please. Give him some medication so he does not feel any pain. So there is dignity of these people. My mother, my brother, and my husband, they were in very good surrounding and clean environment, surrounded by people who love them and understand their condition. Care home was absolutely fantastic, and doctors contacted me through video, and there are nurses in this care home, and I could check all results. So on his last day, I've been there twice because there was something that I was feeling, and I was able to say goodbye to him. And I told him that everything is going fine, that everything is under control. And because the people who are dying, they need to have reassurance from us that we can keep going and everything is fine. They cannot leave this world without this. So at the end, I told him, I let you go. So he peacefully died. Well, this is the story.
Yeah. Thank you so much. Thank you so much for sharing your story. I know it's so difficult to go over, but it sounds like you had the best experience that you could have had in that circumstance. So we're aware of the time, so we'll wrap up there. We can obviously talk about it for all day if we had time, but we don't. So thank you to the ICB and Reading Borough Council for choosing carers as the topic, because it's obviously something that we're both really passionate about, and we're happy to take any questions at the end.
Thank you so much, Millie. Thank you, Tamara. I didn't catch your husband's name.
My husband's name, it started with J. In Spanish language, it's pronounced Joaquin.
Oh,
but you can
lovely.
also say Joaquin. This is like
Joaquin.
Yeah.
Lovely. Thank you for sharing Joaquin's story, because actually what you've shared is very powerful, and it's full of what you valued, and therefore it's the things that we need to think of. The questions we're going to put in polls is what is important, what does it mean to die well, and we just hope that people will, triggered by some of that discussion, maybe start to share the things that they feel are important and how we can apply what we've just heard. But yes, thank you. I am going to move us on. I'm moving us on to Paul. Paul's very kindly come to talk to us and also to share an experience, a lived experience. And Paul, if I may, I'll let you introduce yourself and you can have some time to just communicate to us the things that you've learnt through the experiences you've had. Thank you so much.
Thank you. Thank you, Jane. Appreciated. So good afternoon, everyone. My name is Paul Robertson. I'm a Care Quality Officer at Reading Borough Council. Within my role, it's my responsibility with the team I work with to manage the care quality of care services across Reading, and that includes care homes, home care services, and many other in between. And the reason I do this job is very much, I've worked in health and social care for the last 20 years, working in health as a carer across many settings over the years. But the whole reason I do this job is because of my lived experience. Because unfortunately, when I was 17, my mum was diagnosed with incurable cancer, namely being lung cancer. And unfortunately, it was a very quick journey for my mum. She was diagnosed in the September of the year and died, unfortunately, some 6 months later. During that period, the Health and Social Care Service was absolutely fantastic in terms of supporting my mum. But my mum was actually a person that was quite private, didn't like interference from outside people. So she made the decision quite early on that she wanted to be cared for at home, but she also wanted to be cared for by her family. So I became essentially an informal carer, and I did that for a period of 4 to 5 months before she sadly passed away. And as part of that, at the time I was 17 years of age, so I was quite young, and that involved very much supporting on a daily basis to get washed, to get dressed, and ultimately ensuring that she was taking medication, she was comfortable, she was able to eat, drink. And whilst at the time, being so young, I didn't necessarily realise the level of stress and toll that takes. And actually, it did put quite a stress on my own mental health and well-being. And at the time, there was lots of support offered from community palliative care teams, the Royal Berkshire Hospital. But my mum initially was quite displeased at that level of support and wanted to manage at home with our support for as long as they could. Unfortunately, though, with her lung cancer, that condition developed as we expected it to. And there did come a time where it was non-manageable for us to be informal carers. So we did have some support from community palliative care teams, from community care services, and they were absolutely fantastic in guiding us through probably one of the most difficult processes and parts of our life. And there did become a time, unfortunately, where mum was unable to communicate, unable to express her wishes and views. Unfortunately, because of how things unfolded, during that period, we weren't able to get my mum's views and wishes on paper or written down anywhere. And we call that now advanced care planning. So when it came to decisions around my mum's views and wishes towards the end of life, it was very difficult to know actually what would my mum want versus actually family. But we were grieving before she'd even passed away, so it was very difficult to know what actually would be best for my mum, what would mum want, but also actually what would we want, being selfish in some respects to the family, because nobody likes any loved one to pass away. So that was really difficult. And one of the things being essentially her informal care, if you like, that looking back now that I reflect upon, was she went into hospital, and the hospital were fantastic. I can't fault them. But one of the things that, looking back now, would have been really useful was I knew my mum's medication regime inside out. I knew what my mum liked, didn't like, how she liked to be supported, and actually what benefited my mum and how she liked things done. That wasn't actually asked of us by the hospital, and unfortunately, I think my age had something to do with that. I was very much, it felt I was brushed aside. So actually, there was a lot of matters in my mum's care that once she went into hospital, I felt at the time as if I was redundant, and actually not able to contribute to my mum's care. Realistically, looking back on that, that probably wasn't the case, but I felt very isolated. I didn't know where to turn. I didn't know what support was out there. And the message I want to portray across today is there's lots of support out there for people, whether that be carers groups through my colleague Millie, whether that be through Sue Ryder, whether that be through adult social care. There's lots of areas people can turn to when they're caring for a loved one at home to enable you to actually still care for your loved one at home, still be a huge part of your loved one's support, care and journey, and also to make that journey as pain-free as possible. And that support isn't there to take over, it's there to assist and work alongside the person that's unfortunately dying, but also their family, to ensure that you can still be family as well as a carer, because unfortunately sometimes being a carer does take over and you lose that sight of actually being a son, being a brother, being a wife or a husband. And that burden sometimes weighs very heavily. And even for me, some nearly 20 years later, I do think about that stage of my life, and it did take a toll. So there is lots of support out there for individuals. And if you don't know where to turn, it's very easy to speak to people like your GP or other health professionals that you would regularly engage with, and they will know the right path to support you, assist you, or your family to go down. So that's my lived experience. And the second part of my talk, if I could have the next slide, please, is in relation to a case study. So this is Martin's case study. It is anonymised. Martin isn't his real name. But as part of my current employment with council and what I do for a job, this is a recent actual real life event that took place. So Martin was a 64-year-old man who had a diagnosis of motor neurons disease, MND for short. So Martin's family made a very similar decision to what we made as a family, that they wished for him to stay at home for as long as possible. They absolutely knew his condition was life limiting and ultimately would lead to him sadly passing away, and how this impacted him as well as themselves. But they were really clear they wanted him to stay at home for as long as possible. Unfortunately, though, Martin's health declined to a point that he needed to move into a nursing home in March of last year. That was facilitated by Reading Borough Council with support from our adult social care department, and Martin moved into a registered nursing home. Martin was very clear to his family and also to other professionals outside of the nursing home of what his views and wishes were. Unfortunately, though, those views and wishes weren't necessarily transferred to the nursing home, and also essentially advanced care planning wasn't facilitated at an early enough stage. This led to Martin unfortunately passing away some 3 months later within the nursing home. And even at that stage, the experience and his views and wishes and the journey he wished to have a good death weren't available to nursing staff. So they weren't sure. Did he want his family present? Did he want music in the background? What did he want when his time came? And that was never really explored by this particular nursing home. And that led to the family and Martin really experiencing a negative view of care services, a negative view of this particular nursing home. And actually, to Martin's family, that left them very distressed after his passing. And actually, it made the grieving process so much harder for him. So that led to myself and some colleagues in the council getting involved in his case. And if I can have the next slide, please. We looked at the case, and whilst we couldn't change Martin's experience because of his motor neurons disease, which we know is progressive and will ultimately lead to someone sadly dying, what we could do is say what lessons can be learned from Martin's case to help others in the future, for the nursing home in question to learn from this, and actually what can we do to try and improve knowledge, understanding and experiences of people moving forward. So some of the key things that were found from Martin's case was the importance of communication and considering both the person's and family or friends' views and wishes. That wasn't done, but that was an area of learning the home found they hadn't done and would be beneficial moving forward. There was also areas of learning around the importance of early advanced care planning. Bearing in mind, I said earlier, Martin went into this care home in March 2025 and died some 3 months later. That was 3 months where that specific service had time to have those difficult conversations and to say, actually, what would you like to happen? So that was also identified. There was also a need for a cultural change. We know it's difficult talking about death. We know it's difficult about talking about dying. We know that and not everyone's views and wishes and what they'd like is the same. So there was a need for to have the right conversations at the right time. As part of that, what this service have done is they've completely retrained all of their staff. They've sent them on bespoke training. Sue Ryder have kindly gone in and assisted with holding difficult conversations and lots of other things as well. And this service has now gone through a significant period of change with our support as a council and with support of allied healthcare professionals. And I'm really pleased to say, actually, the family of Martin were heavily involved in this transition process because they wanted to be. And where we are now with this service, hopefully, is in a place where, should a similar situation occur again, actually this home will be able to proudly start advanced care planning early, start those difficult conversations to enable that journey to be better. As part of this as well, they've also looked at this service actually as a national service. So they have homes all over the country. By doing the work that we did in Reading, it didn't just change local perception, local understanding and local processes. We also managed to change their national policy around advanced care planning, and we also managed to change their national policy around end-of-life care and training for care staff, nurses and anyone else in the home or service that may need it. And by doing all of this, we've ensured that the experience and journey for future people is ultimately better as a result. And by no means this service, they absolutely acknowledge where things didn't quite go right. But the important thing here was they've learnt from it. And actually by doing this, it will generally ensure that should Martin, anyone with similar Martin's condition, motor neurons, but anyone else, whether it be dementia, anything that's life limiting, their journey should hopefully improve moving forward. I think that's my last slide. If anyone's got any questions, I'm more than happy to take them as part of the Q&A that I know we've got planned later on. And I believe I'm handing over to Alison.
You are. Thank you, Paul, so much. And thank you for sharing not just the story of how a situation that was difficult and hard can be turned into something that's positive and with good outcomes for future patients, but also for sharing your personal story. We really appreciate that today. And I just would encourage people who haven't yet done it to put their views into the poll. What does dying well mean to you? Hopefully those two speakers have been able to trigger some of the things that really matter and maybe allow you to consider that question. We've also got a second question, which is what enables us to give good care. So I think that question would be also open now for you if you would like to start answering it. There was one question. I think that at the moment it's gone into the chat, Paul, so maybe we can pick it up at the very end. And I could just move on then to ask Alison. I think, Alison, are you coming to talk with us on your own or with somebody else?
It's just me today. It's just me today. Yes. So
welcome, Alison.
Thank you. So I'm Alison May. I work for Rennie Grove Peace Hospice Care, and we work very closely with Sue Ryder. And I wanted to say thank you to all the stories that have come out here, and actually Paul's point about really having those open conversations about advanced care plans and our wishes at end of life is so important, and so important to do it early before we actually get to that stage and we can really work on. So today I'm going to talk about a little bit about what Compassionate Communities is and how it links with hospice care, okay, and how we at Rennie Grove delivered that service. So we're going to touch on what Compassionate Communities is. Thank you for moving on. What what the Compassionate Neighbour Programme is, which is something that has been picked up by quite a few hospices. Why it achieves what people want around death, dying and loss and everything, and the notion of shared power and resource, okay, and how we at Rennie Grove Peace deliver our Compassionate Neighbour Programme. Just next slide, please. So Compassionate Communities is lines very much with what been talking about a compassionate city, compassionate communities from a borough point of view, but it's looking at the public health approach to end of life and encourages communities to support people, their loved ones, and everyone around the subject matter of dying and living with a loss, and enabling us to live within our communities for as long as possible at that end of life, okay, and to really express those wishes. It, as I say, it looks at the making death, dying and bereavement less a taboo subject. It looks at what our expectations are at that stage, and also links with the palliative care and social care support that's available there in the community, but also within the whole of the community and different organisations, including the voluntary and faith sector. There's some really good examples of how compassionate communities works in Australia and Kerala if people want to have a look at in India and in Ireland. So just have a little look at that. Next slide, please. So let me look at how hospices have taken the concept of compassionate community, and some of them how they're delivering it in a service called Compassionate Neighbours. Next slide, please. Okay, so Compassionate Neighbours is something that started in the East End of London at St Joseph's Hospital in 2014. Okay, it was in a response to what the local people wanted around the subject matter of death, dying and loss, and how they wanted how the community wanted to work and overcome that taboo subject. Okay. It looks at how we can work across the community to connect everyone. So we work together as one, okay, and that everyone has that